Welcome to the Sultans of Sales podcast. I'm your host, Jamil Pendleton. Today on the show, we have a guest, likely needs no introduction, Vinod Dasa. And he's coming to us from the great state of Louisiana, neighboring state to me. Dr. Dasa, thanks so much for taking some time out of your day. Welcome to the show.
Thanks, Jay. Good to be here.
Yeah, it's great to finally do this. We've had a few times we've had to schedule and reschedule, and that's just the life today of a busy practicing physician and all the different things you've got going on. So for the audience, if you could just maybe just give an overview of who you are, and then I'll kind of talk about like why we're here today, what we're gonna discuss.
Yeah, sure. So I'm an orthopedic surgeon. I'm vice chair of orthopedics at LSU here in New Orleans. I'm also the director of research. Work clinically in a large IDN health system called Ochsner, which is basically one of the larger health systems along the Gulf Coast here in the U.S. And then we've got some ventures and startups that I'm working on. One is Doc Social, which is a new medical education social media platform specifically for all of healthcare. We've got Site Medical. We've got some other ventures that I'm working on. Clinically, I focus in on adult knee, so joint replacements, arthroscopy, sports, things like that. And then work with CMS on a technical expert panel on some of the things around bundle payments and, just kind of keeping my pulse on healthcare, I guess.
I love it. Well, thank you for what you do. I mean, I certainly have appreciated following you on LinkedIn specifically. And then the Doc Social is such a cool platform as well that you guys have created. And that's really where we've connected is in this, it's this nexus of business, of industry and medicine. And then the clinical side, which you helped educate. We did a prep call. You and I, we talked a lot about, some of the social posts on LinkedIn, which really caught my attention is one of the ones that you'd shared. I think reshared a rep just boasting about an award, right? An award that they'd won, rep of the year, X million dollars, all that kind of stuff. And it hit a nerve for you and you shared it. Can you just maybe encapsulate maybe for folks that didn't see it, or just to kind of reset, how did that sit with you as a surgeon or clinician, and why did you choose to post that?
Yeah. So, it's interesting when I just took a post that one of the Arthrex reps, I think it was Arthrex shared, and it was just, that not a plaque, but the trophy, crystal trophy thing, where it said $5 million territory or all I remember is 5 million, with that thing. I don't know if he made it or somebody made it or what.
Sure.
And so, so from my perspective, I saw that I'm like, I've got nurses that are struggling. I've got a hospital that shut down for 6 weeks. I've got all these things going on. And here we are celebrating this success. And I was thinking to myself, and I had no issue with celebrating success, right? That's totally normal and that's totally acceptable. And in fact, if I was running Arthrex or whatever company, I'd be doing the same thing. I mean, obviously, not everything can be a charity. But then I started thinking, and I was putting that, I was thinking to myself, how does that compare to how we celebrate success on the clinical side? And what I was thinking is, all right, do I ever see a nurse getting awarded for bringing in X millions of dollars? Do I see a physician, a surgeon, family medicine doctor, endocrinologist getting an award that they brought in X million dollars to the? Then I was thinking, all right, what about the C-suite at my hospital, the CEO? If they do, I have no idea about it. It's happening kind of somewhere. I'm sure he's being judged on a P&L that is important, right?
Absolutely.
So I'm thinking, okay, so this is how industry is celebrating success, but that's not how we're celebrating success clinically. But I thought we're all supposed to be interwoven in one team, like one kind of cohesive group. And so my success is your success, and your success theoretically is my success, with the patient being in the center of that. And, and I made a statement. I don't think any company has in their mission statement, we're out to take advantage of as many patients as we can to make as much money as we can, right? That's not the mission statement for anyone.
Right.
It's how do we help as many people as possible heal, prevent pain, improve function, whatever it is. And one of the byproducts of that is this financial success. So if that's the case, if we are saying, the mission statement of a company or a health system is we're here to serve, teach, heal, whatever it is, then why doesn't our celebration of success align directly with that mission statement? We all know healthcare is a business. There's no, if I did one surgery a year, that wouldn't work, right? And I get it. And that's not the point of that post. My point of the post was how a person at risk, taking care of patients, celebrates success is very different than what I saw on that post.
It is.
And why are they not more closely aligned? So I will never win a $5 million award from any health system as a surgeon. That just doesn't happen. Right? Actually, we don't win awards for much of anything in healthcare because we're just here to do, right?
That's exactly right.
Bang it out. So, but over here, because it's a business, it's an acknowledged business. On the hospital side, we don't want to admit it's a business.
That's right. That's the key distinction, I think. It's acknowledged. It's part of the culture, the DNA of industry. I mean, I'm thinking about looking over here at those similar awards that you're talking about. And yes, I'm proud of them. And as you said, that's how we're measured. That's the only way, at least at this stage, industry is measured is in revenue, quota attainment, right, and achievement. And then when you go beyond that, that's when you hear about the president's clubs, the chairman's clubs, and those types of things for the best of the best, the elite. However, it is always been, at least for me personally, I can't speak for anyone else, but for me personally, I always felt awkward about the awards because it was this surgeon and then ultimately that patient that was, kind of the only way to get to those awards is through the surgery. And then you mentioned this, and I wanted to kind of talk more about it. We're in an interesting time in healthcare where cost and the dynamics and you kind of got thrown right in early on in your career, which we talked about off mic. Can you talk a little bit more about that? Because look, we can talk all day about this debate, but I think it's helpful at least very helpful for me to understand the dynamics, the shifting dynamics, and how you are measured and what's important to you today as a clinician and in the ecosystem of, care.
Yeah. So let's back up a little bit and put this in context because, you graduate from med school, residency, fellowship, like there's no business of medicine, anything. None of us know how industry functions. Honestly, you could probably go to just about 90% of physicians and ask them the difference between sales and marketing at a company, and they won't know what that means.
Some of us don't really understand it either, but
so we just see companies as just this big thing, this big blob that is there to deliver a drug or an implant or whatever and help me to a patient. So I don't know, again, I'm contextualizing here in terms of the whole thing. There's a disconnect in terms of how, and I doubt in nursing school, they teach them the same thing. And I doubt in physical therapy school, they teach them any of this. So there's a disconnect, I think, with how we think versus someone that's brought up in a pure business environment.
That's right.
And so when I got recruited to LSU, it was post-Katrina. And as you imagine, the city was decimated and they recruited me to come down to help rebuild. And I got thrown into the business side of medicine, if you will, early because there's no one else. I graduated fellowship and it's like, who can attend this meeting? And you look around, everyone's gone. I'm the only one there. I just got there. I literally just got like my parking pass. And they're like, you need to come to this board meeting because we've got an RFP on an implant thing. And you got to tell us how this needs to go. I'm like, what's an RFP?
What's an RFP? Yeah.
And they're like, oh, supply chain hands it out. I'm like, what's supply chain? Like, amazing. Man, I'm just trying to figure out where the patella is on the knee and how to make my incision. And I'm getting thrown into the deep end here. And so early, like literally my first 3 months in practice, because I got brought in under these circumstances, I got exposed to this side of healthcare very quickly. I thought a boardroom was like on TV somewhere. I'm like, I'm sitting in one of these leather chairs in a boardroom. Like, well, this is crazy. And so then I got exposed to kind of this side of healthcare that gets hidden from us, whether probably purposely, because we just don't, depends on what we value. Right. And so you can see what healthcare values, it's at least in the training part of it, it's not this. It's biology, it's physiology, it's pharmacology and all this. And so we learn this side of healthcare as we go. And I just got exposed to it like within 3 months, as opposed to 5 or 10 years into my practice. And so that's kind of the lens from which I've been looking at things, because I was brought up with these things in my head right out of the gate when I joined practice. It wasn't something that was like, you're 10 years in practice, like, hey, Dasa, I need you to sit on this committee now, right?
That's right.
Like, and by then now I'm already jaded. I hate the world, right? Someone's out to get me and all this stuff. So I looked at it really in the beginning from like, this is really weird. Like, why does it work this way? Because this makes no sense to me. Before I had any bias or any preconceived notions of how things should be. And so that's kind of helped me frame up some of these things as we move forward. Like, no, I get it. This is the way it has been, but no, it doesn't need to be this way. And I don't understand why. And so same thing with that award thing. It's like, if everyone's so focused on the patient, then why isn't that award about, let's pick the spine company you work for, how many patients were able to go back to work? How many opioids did you guys remove because they weren't addicted to them? So where is the clinical relevance? And the feedback, the pushback I saw on a lot of it was, well, that reward represents X, Y, and Z, right? That reward, $5 million, represents how many patients I took care of. So fine, then flip it then.
Flip right? the focus.
Put the award on how many patients you took care of and do the math on the back end in the back office about how many millions of dollars that equals. That's all.
I think it's changing too, because like, you're right. And I'm in this new world of, trying to create a market, which doesn't exist. So it's all about value analysis. It's all about getting the surgeons to help champion this and get it across the committees that you were likely sitting in early in your career to evaluate the costs. And I think there's some optimism that we're coming together more, because the relationships are still there. You work with your reps, I work with surgeons, and there's a lot of time spent. And I think we talked about this a little bit before on our prep call about we have an opportunity maybe to change this together, right? And could you talk a little bit about like how are you measured? I mean, I think we all know, like, right, reoperation, some of those things, but like, are those things that is there any sort of ranking of physicians, or is there any sort of similarity of like, all right, I've done a great job this year based on this? Is it patient satisfaction score, or patient reported outcomes? What are you guys as surgeons, clinicians in the community, what are you looking at?
Yeah, so that's a great question. And I think we're in the infancy of trying to figure out how we measure physicians in hospitals, because it's really complicated, right? Because if I take care of a lot of obese diabetic patients, my outcomes and definition of success may be different than someone that's treating healthier, wealthier, younger patients, for this given surgery. So it's a very complex area, but generally speaking, right, you've got the financial metrics. So how many patients, and it's really top line at this point. We're still in a fee-for-service world. As much as we talk about value-based care, there's a paper I actually posted on LinkedIn. 90% of the physicians, their incentive and their comp structure is purely based on volume. So even though we talk about value and trying to control costs, as of today, if you talk to your average doctor, their compensation is still based on volume, with very little, if any, attention paid to quality or cost or metric. But if we look down the road, and remember, healthcare is slow. It's a Titanic, right? But we see what's coming down the pike. And what's coming is we're going to measure you based on quality, whatever that means. And so some of the early ideas of what that means, for example, length of stay is a very easy one, right? If you're doing a standard total knee replacement and your length of stay is still 2 or 3 days, that's going to be a red flag for a lot of places, right? Because obviously now it should probably be somewhere in the neighborhood of 1.2, 1.4 days, something like that, right? Certainly not above 2 days.
Correct.
In general, right? Of course, there'll be exceptions. So think about that then. How many total joint reps? So knowing that this is a metric that's extremely important. We talk about ERAS and enhanced recoveries. The employers are interested in this. The payers are interested in this. We have insurance companies now that won't approve a surgery if it's not done outpatient, right? So how many reps listening to this know the length of stay of their doctor? I'm not even being allowed to do surgeries based on my length of stay right
That's
now
right.
because the insurance won't approve it, right? So if we want to talk alignment of companies aligning and being kind of in sync with their surgeon, if the rep who's been covering a surgeon for 10 years doesn't know what your length of stay is, then how do we move forward? That's a basic, but they sure as heck know how many points they're getting on that implant.
Yeah, it's a good point. I mean, I think it just comes down to a couple different things. What are the intentions of the rep? What's the culture of the company? And, kind of how does that relationship fit in together with the surgeon? Like what level is it at? So if you're just a vendor bringing in trays, opening up boxes, checking, filling out the chart sheets, then yeah, you're probably going to look at it just purely based on numbers and revenue and kind of a very, I don't want to say selfish, but just very narrow focus of like what's in it for me, the rep, right? Or the vendor wearing the red hats and just kind of getting cast aside. If it's different, if it's consultative, if you're part of that surgeon's team, which is what happened with me, I feel for the bulk of my career, I was a valued member of the team. Then completely all of that stuff doesn't matter. In fact, it's just, and honestly, you look at it from, that's just, if you get the awards, if you do these things, it's truly a byproduct of serving you and your customer, or excuse me, you, the customer, and your patients. And then everything is focused on that, from R&D for the company to how we position and message our products to the surgeon. Because again, at least in spine, we don't do a ton, if any, of direct to consumer marketing. And I think in total joints, it's different, that, you see things in the magazines that, some of your patient population might be reading about, some of that stuff has trickled down to the patient. We don't see that a lot in spine, at least not today. But I think that there's opportunity for change but you have to be in the right mindset. I think sometimes, like if you look at Karate Kid, right? You look at the Cobra Kai, it's all based on the sensei, the student. It's not the student as much as it's what they're being told to do, what they're being taught to do. They're just trying to carry a bag and meet their goals. And again, that's how they're measured. I'm not saying it's right. I'm just saying it's kind of how it is today.
The sticker on the invoice sheet should represent something more than just the SKU that was opened up, right? That sticker on the sheet, I should be paying for someone that's helping me create a better surgery, a better clinical quality for that patient. That's what that sticker should represent. It shouldn't represent me just bringing a bunch of totes in and, with a laser point. It should represent the entire surgery, right? You're helping me create the most optimal whatever to deliver the highest level of care. So if that's helping me reduce length of stay, great. And it's manifested in the sticker. So I'm hiring, when that hospital gives you a check, that's theoretically, I think this is where we're evolving to. That's where I think if the reps and the companies appreciate this, this is where you become a collaborator. You hear the C-suite always talk about, we want to collaborate with hospitals. We're here to be partners with them. The typical stuff that you get on the brochures and all that. But ultimately, the people on the ground in the trenches need to buy into that vision.
That's right.
And that's the culture that has to shift, that the sticker on the invoice sheet represents something bigger, something broader, something more substantive than a SKU on a box.
Something bigger than I really like that. But a question that I have just popped in my mind. We were going through some initial conversations with value analysis and talkings back a couple companies ago, but our implant cost was greater than the average. So we had to absolutely look at the clinical value, and length of stay and blood loss were two of the main focuses that we had. You kind of in this presentation of why are your implants more expensive than our contracted price or whatever it is. And I got a sense, and I don't want to, this isn't a blanket statement. It's just, again, an N of one. This is one value analysis person, but I got a sense that length of stay or blood loss, or let's just say a clinical value, ended up not mattering nearly as much as the fact that it was just more expensive. And so I think the disconnect is on both sides of a hospital administration as well as us.
But because you don't value that, you don't resonate with the surgeon. They're not standing on the top of the mountaintop, right? And rallying all the nurses and rallying the OR staff and rallying the OR director and rallying the other surgeons, right?
Right.
You got to win hearts and minds.
That's right.
It's not winning over the heart and mind of the CFO. Actually, it's the people in the trenches. So you got two options, right? Implant price is only heading in one direction for a lot of things.
Down.
So if we want to so you can either do the same type of work, right? And what the system is saying is we're not going to pay as much for that same amount of work, period, right? That's what that box and that sticker represents. Or you want to keep the price the same, then we expect more for that price. You got two options. Either price goes down and you do the same type of work, or price stays and you offer more. That's just the bottom line here. So what is that? So you got to decide what you want.
That's okay. So what is that though? Because we talked, you and I, a little bit about it. Like, I like the rep. I think these were your words. Like the rep is at an interesting place in terms of their relationship. They have an opportunity to bridge this across because of that relationship, right? That to help maybe catalog this data. I mean, I don't know if every surgeon is out there tracking all of their metrics. Maybe there are, maybe these are tracked for you, but to your question of like, does a rep know their surgeon's length of stay? And, we should absolutely kind of have that cold and have those metrics and almost be an agent for the surgeon. And I think this is happening in some areas, but it'd be cool to see it widespread.
No, I think you're dead on with that.
And so just talking about what you've seen, let's pivot for a second to, some of the entrepreneurial things that you're seeing with Sight Medical and some of the other things that you're passionate about. Why I think this is connected, and I don't want to speak for you.
Sure.
Can you talk about that and like relative to this, greater topic of advancement and value?
Yeah. So, Sight Medical, this is technology really to support the OR staff to improve their proficiency during these surgeries. It's not a threat. And again, the reps that see this as a threat don't get it. Right. The reps that realize that they've got to deliver a higher level of performance for the same amount of money get it. So for example, we have a technique guide, my digital technique guide, that put up at the screen. It helps the scrub tech go through the case. And what happened last week was my rep was there. They weren't anywhere except in my room, but they spent the entire surgery staring at my scrub tech, analyzing how she was handling everything. He didn't spend probably less than 5 minutes actually watching me do the surgery. And he improved her performance by about 20%.
How do you measure the performance?
So the number of mistakes. So we can record the surgery. We look at the, did they move something from the back table to the Mayo? So for example, an easy one was when we watched the surgery, the scrub tech should know what my next step is, right? Theoretically. So in theory, it should be on the Mayo stand, not the back table, right?
That's right.
Theory, right? But if we see something that she grabs from the back table and hands it directly to me, it wasn't prepared properly, right? Or she wasn't far ahead. So she should have known that should have been right there, right? So that's one simple thing that you can easily check. And you can't do that if you're watching me and them and so how do you transition from someone if you don't want the price of your implant to change? Then what are you going to do other than scream and cry and kick and yell about maintaining that price point? So there's got to be something there that you're going to deliver. And so what is it that you're going to be able to do for that? And so that's what I'm talking about. It's not that you're not valued. In fact, I think the rep is strategic because think about it. There's no other person in healthcare that's able to manage so many different components of healthcare in one skill set, right? They know how to deal with the C-suite. They know how to deal with the OR director. They know how to talk to nurses and scrub techs. They know how to talk to surgeons. They know how to talk to central sterile. They know what motivates everybody. They know how to interact with everybody. Those stakeholders I just named actually don't really know how to work with that whole group. The rep is actually central to those things. So they are uniquely positioned to help the OR in a way that the OR can't without hiring some crazy consultant to come in for a gazillion dollars, who then at the moment they leave, everything falls apart. But the rep is still there. So they're able to create sustainable change by leveraging the skill sets that they have and the knowledge they have, because they can blend the clinical with the business,
Right.
with the operational, right? And manage the relationships. They have so much potential to change how ORs function, but we've got to figure out how to get there.
It's very well said. And it feels like it's not as much an attack on kind of how things are. It's just you seem, at least as I'm hearing you speak and done the research on what your interests are, or where your interests are, you seem to be very driven by how we can improve things and passionate about this space right now and how it is evolving. And if you see this divide that's existing between the box checkers and all the focus on revenue versus all the other things that you're focused on, if we keep moving in the opposite directions, it's never going to get better. It's only going to get worse, right?
It's going to be a food fight, and it's going to be an ugly one as we move forward. But the market will decide, right? I mean, the reps that decide to go down this path will probably be rewarded. The folks that don't are probably going to be stuck in these supply chain, GPO, RFP back and forths that everybody enjoys. And the market will kind of decide who the winners and losers will be. If you think the standard is the way it's going to be, then, put your chips in and let's see what happens. Right.
Well, the only thing constant, I think if I've learned this, the only thing constant is change. And it's like, this is an evolving landscape every year.
Physicians are evolving. We have to evolve. We're getting measured, in the fee-for-service world 20 years ago, you just bang out a bunch of surgeries. Doesn't matter if it got infected, doesn't matter if it got readmitted, doesn't matter much of anything. Now, all of a sudden, we're getting measured and analyzed in ways that no one ever dreamed of. It's hitting us just as much as it's hitting anyone else. And so we're trying to figure this out. And so, likewise, that same momentum or trends is going to impact everyone in my sphere of influence. So if I'm trying to navigate these waters as healthcare changes, then who's going to do it with me? I think the reps, again, are uniquely positioned to help me navigate this, because I'm focusing on patients, I'm focusing on clinical. So who's holding my hand on the business side of this? Who's helping me navigate all these other things? Who's helping me become a blue chip player?
Yeah, that's great. I really. So, okay, let's take that a step further. For those listening, I would assume the audience is going to be largely reps and people that are aspiring to be reps. Maybe a few surgeons, and hello, surgeons, if you're listening and watching, thank you. What's advice from Dr. Dasa that we can do? What would you like to see? Maybe just a few things like that to help bridge that change.
I think very simply, how are you going to help me and my team be better? Very simply, and do it in a way that's objective and that you can measure. So maybe it's length of stay, maybe it's infection rates, maybe it's OR efficiency, maybe there's so many things. I mean, you're a rep, you're in the OR, you know where the issues are, right?
That's right.
So find them and help me fix them.
That's right. Measurable value. That's what I heard. I mean, what is it? And I think being acutely aware, being aware of your value that you can then provide, to the surgeon, to the entire hospital is really, really important. And, I think that's great for me to hear. That's great for anyone listening to hear. So I really appreciate you sharing that.
Yeah, no problem.
Anything else you'd like to address? I know I don't want to keep you too long, but is there anything else you'd wanted to maybe discuss or promote? Wanted to give you the floor to do that.
Yeah, no, I appreciate it. I think a few things. Number one, we're doing a lot of work here at LSU around health disparity. So one of the other important things for me is trying to figure out how do we solve some of the inequities and disparities that we have in healthcare. How do we understand that? How do we create a level playing field for patients that are marginalized by race, socioeconomic status, things like that? So I think that's important. I don't think industry is really on board with these concepts. I mean, it's blowing up obviously all over, everywhere, but in healthcare and on the industry side, you don't see it. So for example, we're working on a paper right now with the American Joint Replacement Registry, looking at the deployment of advanced technologies, let's say robots and premium implants, based on safety net hospitals versus private community hospitals, right? You can imagine where all the robots are and where they're not. Okay. So you're a company selling robots, selling implants. So what are you doing to solve this issue? What are you doing to create a level playing field for patients, so we make this a more equitable system? Whatever you define a premium implant to be, whatever you define an advanced technology to be, so what are you doing to help solve this? As a rep, as a Fortune 500 company, where is your role in this?
Right.
Because it's something that we all have to work together towards. So that's just a simple example of some of the initiatives that we're working on. Doc Social, like you mentioned earlier, is a education social media platform where the vision is really, as healthcare moves forward, most of the decision making, whether it's to write a check or use this or use that, is now a team sport. It's no longer the sole purview of the surgeon. I can't go to my CEO's office anymore, bang my chest, and say I want X, Y, and Z.
Right.
Those days are gone. Now it's you mentioned it, you got the VAC committees and all this stuff. It's now a nurse, a therapist, a pharmacist, a surgeon, the CFO, supply chain, all at a table collectively making these decisions. So if that's the case, then how do we get everybody in healthcare on the same page, right? Previously, it was we only talked to the surgeons. We didn't care about anybody else because they were the rainmaker. They were the ones that were going to, be able to push this over the finish line. And we created the platform with the idea that, yes, the physician still needs to be the champion, but they're no longer the decision maker. They're no longer the one writing the check. And so how do we get everyone in healthcare on the same page? That way, I don't have to spend as much energy convincing everybody. So is there a platform, and obviously everything is digital now, right? So is there something where all of healthcare can get together and learn and teach and interact collaboratively? Because most of the stuff right now is very siloed, right? This is only for nurses, this is only for therapists, this is only for doctors.
That's right.
But what's happening, right? We're all slowly kind of coming together as a global team. And so that was some of the kind of the concepts around Doc Social, is how do we get everybody on the same page? That way we can kind of move the needle a little easier, a little more quickly.
And what I like about it is, I'm recently signed up, and I like the fact that you can search, you can be part of a very niched specific chat or excuse me, topic. Because, you and I met on LinkedIn. You're one of LinkedIn top voices for 2022, right? I mean, LinkedIn is going to be here, but this is more of a place where you can go a little bit deeper, right? On a topic. Is that kind of the, and then beyond? I mean, there's opportunities.
So I think Twitter and LinkedIn and Instagram, all that stuff's great because it allows you to screen what's important to you, right? All these ideas come and you see a post, like, for example, I was on LinkedIn and I saw an interesting case. And I was like, oh, let me read about it. And then I accidentally hit a button and I wanted to go back. I couldn't find the post. It was gone. Right? It moved to the next, whatever the algorithm says. Like, oh man, I don't remember who posted it. I don't know. It's gone. So everything is so fleeting on these platforms. So what I'm envisioning is there are important topics that deserve more than just a quick 15-second glance. For you, right? For someone else, it may be different. For someone else, it's something different. So for those topics, how do we create an off-ramp? Obviously, specifically for healthcare, how do we create an off-ramp for those topics? So for whoever that topic is important for and resonates with, they have a place where they can dive deeper with it, with whoever that is. Maybe it's 5 people, maybe it's 5,000 people, whatever. If that's of interest to you, let's offload it. And that's why I created the group on interesting, tough cases for hip and knee, because these are very cool cases. They happen to day-to-day physicians. And let's say this case comes in today while you're on call. Like, what are you going to go look in the LinkedIn library for tough cases? Like, where are you going to find a solution for this challenge you have? You can't.
That's great.
Well, actually, you call your rep. Hey, what did you see? Right. So is there a library? So again, can we take these fleeting concepts, not fleeting for some people, fleeting for others, move them over and then have a deeper dive? Right now on that interesting case group, you can find the x-rays that match yours, actually go find the surgeon that solved it and get some ideas. Right. So that's what I'm saying. We got to screen this on one side and then move some of these things over for a deeper dive.
Is it a community that you're creating? Like, what's the end goal of Doc Social? You mentioned the siloed, everyone's siloed, and this kind of helps bring bring it all out there. But then there's also the focused aspect of, the topics, like where do you see this going long-term or larger scale or?
So, so that's a great question. We can add to our pitch deck what the,
there you go. There you go.
But, the goal here is really to create a platform where you have a community, you've got a broad community to which you belong, which is just healthcare. And then you can find your individual homes. Because as a physician, maybe I have zero interest in digital health, but I really, really like infections, whatever, right?
Whatever it is.
So I've got it now, right? And in that now infection group, I've got infectious disease, I've got wound care nurses, I've got maybe companies that have infection-based products, I've got other like-minded doctors. So now I'm in a infection community.
So sorry, keep going.
No, go ahead.
Well,
that's my point.
I just thought of, it's one of the most common inbound questions, at least that I used to get. I think people realize that I just don't have the time or the bandwidth to address them, is how do I break into medical sales, right? How can I get into this world, Jay, that you're in? And it's a completely, I would say it largely depends on the situation. But the number one thing that I tell people on videos that I've posted to LinkedIn, the one-on-one calls that I've had, you have to do your research. And I think back to my time in 2007, I was trying to break in, and I can't even tell you how much research, anything I could get my hands on online, right? I go to these different big companies. I went to Rye Ortho. That was a big one. I'd read like the rankings and all those things, and just like consume the information, because I had to at least understand the language. And if Doc Social would have been around back then, it would have been so, I think, great to just get down the rabbit hole of like all these different discussion points, and then truly figure out where I would like to take my career. As I was a sales rep, B2B sales rep, and I was trying to get into this industry, right? And I just think that it's a great place for information for those people that are just looking for more, or for someone like yourself, a clinician that has a tough pathology and wants to collaborate and have kind of a grand rounds discussion. I mean, that's just, it spans the gap.
And it's interesting. It was actually born out of COVID. Alok, Sharon, and David Flickinger were going to do an awake spine fusion course up in Seattle. COVID hits, and they're thinking to themselves, all right, so what's the future of medical education and physicians learning from each other? And that's what generated the platform, was originally peer-to-peer education. So how do we train in this new digital world? How do we teach new concepts, ideas, techniques, whatever? And when I came on board, I'm like, well, why is this only for physicians? There's a lot of other people that like to learn too, not just doctors.
That's right.
So I said, why can't we open this up to everybody? Let everybody learn, what the latest and greatest or newest or whatever is, a nurse, a therapist, a pharmacist, whoever. And so what I pitched those guys on when they asked me to join was this kind of broader concept, not just physician. Let's not be another siloed thing.
Right.
Let's open it up, right? Let's get everybody learning from each other, because I bet you a nurse that's done spine surgery for 30 years, probably a scrub tech or circular, whoever, I bet you has forgotten more than most spine surgeons will ever learn, right? So they probably know how to get out of a pickle, or they know kind of, so why are we hearing from them? Why aren't we learning from them?
Right. Give them the platform. Yeah, no, I love it. I think you're really onto something there. And I truly appreciate, what you do for the industry. I'm grateful for your time coming on and just kind of talking about, like, look, it's not that you're, looking down and kind of casting away these celebratory posts, but you're saying is like, hey, do better. Let's think about like what this ultimately means and improve it together, and I think I commend you for that. Really, really grateful to be connected to you. And yeah, thanks again for sharing your wisdom with all of us.
I appreciate it. Thanks for the time.
Yeah, man. Well, thank you all for tuning in this episode of Sultans of Sales with Dr. Dasa. Check him out on Doc Social as well as LinkedIn, and tune in next week.